Good afternoon. My name is Dr. Patty Lisk. I am the Dean of Nursing and Health Technologies at Germanna. It is my distinct honor and privilege to welcome you to our Spring Nursing and Health Technologies pinning ceremony. You are right, this does not look like our traditional ceremony. But what about this last year has been traditional? But yes, graduates, you made it. Despite all the adversity, you did it. Your tenacity and your perseverance are unparalleled. Moving from face-to-face classes to online and Zoom classes, you persisted. Facing unknowns in the clinical environment, you persevered. You attained the clinical hours, the knowledge, and the skills needed to be here today. Congratulations are definitely in order. Our ceremony today honors graduates from across the Nursing and Health Technologies Division. These individuals will become our care providers within the community. Today, we will honor graduates from our many certificate and degree programs. These include nurse aide, medication aide, pharmacy technician, practical nursing, physical therapist assistant, dental hygiene, and registered nursing. Now, you know, I have heard lots and lots of things about the Nursing and Health Technologies programs at Germanna over the years of association with the college. But the one thing I have never heard about any of these programs or these curricula was that they were easy. That's because, in fact, they are quite challenging. Successfully graduating from one of these programs during normal conditions is indeed a reason for celebration. To those of you graduating during a pandemic year, all I can say is, wow, what an accomplishment. So graduates, we celebrate your accomplishments and we celebrate your very promising futures. Families and friends, I am sure that I echo your pride, your excitement, and your happiness as we celebrate this momentous day where we send our graduates forward to their chosen professions. Thank you for supporting and encouraging them in this process. Graduates, I personally wish you well, and I thank you for allowing us here at Germanna to be part of your journey. Today, I have the privilege of introducing to you Dr. Janet Gullickson, the 6th president of Germanna Community College. Dr. Gullickson holds a doctorate in education from the University of Minnesota, a master's degree from South Dakota State University, and a bachelor's degree from the University of South Dakota. Since coming to Germanna, she led the college to become the top-rated two-year institution in Virginia. Under her direction, the college has continued to have increases in enrollment, while our sister colleges have experienced declines. Reaping the benefits of one of her visions, students at Germanna choosing the newly developed College Everywhere program can now attain their associate degree in 1 year as opposed to the traditional 2-year time frame. We in the Nursing and Health Technologies Division thank her for her ongoing support and her leadership. Please join me in welcoming Dr. Gullickson.
Welcome. I'm Dr. Janet Gullickson, President of Germanna Community College. We are here to honor a long rite in the development of healthcare, and that is the recognition of healthcare professionals such as those at Germanna entering the workforce and pledging their oath and allegiance to the time-honored tradition of caring for others. Nowhere has that been more importantly seen than in the last year with our COVID situation. I want to thank all of you who are entering healthcare fields for pledging to care for us, because it's a special, special gift. Congratulations on having it.
Thank you, Dr. Gullickson, for those kind and inspiring words. I would now like to introduce our student speaker for today. Our speaker is Ms. Heather Fonda. Heather grew up in a military family and has lived all over the world. She has a passion and a heart for animals. Prior to coming to Germanna, Heather used her love for animals as an entrepreneur, managing her own small business. A fun fact about Heather is that she worked for Disney in Tokyo. And do you know what she did? She was a Disney princess. Yep. Heather is a Germanna Community College alumni from our dental assisting program and today is graduating with an associate in applied science in dental hygiene. While at Germanna, Ms. Fonda has been an active member of the Interdisciplinary Healthcare Council and the president of the dental hygiene class. In 2020, Heather was appointed to the Virginia Dental Hygienist Association Leadership Development Committee, and she's been active in leadership development opportunities here at Germanna. In the fall last year, Heather noticed that a lot of her colleagues were concerned about entering the job market. In her desire to serve her profession, Heather took on a project independent of her curricular studies, where she surveyed area dentists around the state to examine their perspectives of interviewing potential employees. She then used this data to create a statewide preparation course that would help students further transition into their role of licensed professionals. Her course was well received and sponsored by a national placement agency. Heather, we welcome you.
Good afternoon, distinguished guests, family members, Germanna faculty, and most importantly, the graduating class of 2021. As a Germanna Dental Assisting alumni and current dental hygiene student, it is my honor and my pleasure to have been elected student speaker for today's ceremony. My journey with Germanna began in 2016 when I decided to go back to college to embark on a whole new career. Juggling a job and family obligations with the demands of prerequisites and then one high-stress, high-stakes program after another has been tough, and I know my fellow graduates can relate in some way or another, but I did it, and so did you. Our hard work has culminated into this momentous occasion, and although COVID prevents us from being united in person, we are united in our accomplishments. Today, the dental, nursing, and physical therapy programs collectively honor us and the pinnacle of our educations with the degrees we have worked so diligently to earn. As emerging healthcare workers, we selflessly focus on the needs of our patients. Even in a world that is still vastly affected by the COVID pandemic, we have remained courageous. We stuck it out and finished the programs we started. It takes a special kind of person to set the needs of others above their own and to gain fulfillment in doing so. We are that person. Take pride in that notion and know that our selflessness, unity, collaboration, and commitment to community is now more important than ever. I want to take this opportunity to thank Germanna, the president, the deans, our instructors, our families, and our friends for all of the support they have provided each of us on this journey. Every one of you has made a positive impact in one way or another on the graduate or graduates you are here to support today. I also want to take a moment to recognize my classmates, 5 amazing ladies I have spent the last 2 years with who have changed me in the most profound ways. Jennifer, Jessie, Kate, Kaylee, and Whitney, thank you for the fun times, the comic relief, the study sessions, the boost when I needed it, the support as your president, and most importantly, the friendship you have provided me. We not only walk away from today with degrees, we walk away with a bond, a true sisterhood for which I am forever grateful. In conclusion, graduates, be proud of yourself and of your achievements. You deserve it. I hope you are as excited as I am to get to work, to make a difference, so that years from now, you take a look around you and say you left things a little bit better than you found them. I wish you all every continued success. Congratulations.
Thank you, Heather. We congratulate you and your classmate on your successes. At this time, I would like to introduce to you our pinning speaker, Mr. Dennis Smith. Mr. Smith received his Bachelor's of Science in Pharmacy from the Philadelphia College of Pharmacy and Science in 1990. With pharmacy experience working for Mercy Catholic Medical Center in Philadelphia, the University of Virginia Health Sciences Center in Charlottesville, and the Neighborhood Care Long-Term Care in Orange, Virginia, Dennis became the Director of Pharmacy at Culpeper Medical Center in 2004. In 2015, he assumed the role of Director of Clinical Support Services, providing administrative oversight to lab, medical imaging, and pharmacy. In 2017, Dennis became the Regional Director of Pharmacy for the Nuvant Health University of Virginia Health System, providing administrative pharmacy oversight for the Culpeper Medical Center, Haymarket Medical Center, and Prince William Medical Center pharmacies. He is currently the pharmacy manager at Nuvant Health, University of Virginia, Culpeper Medical Center, overseeing the provision of safe and effective medication usage throughout the organization. Dennis is an active member of the American Society of Health System Pharmacists, the Virginia Society of Health System Pharmacists, and past president of the Virginia Pharmacies Association. Welcome to Germanna, Mr. Smith.
Thank you for that introduction. Good afternoon and congratulations to nursing and health technology graduates. Again, my name is Dennis Smith, and I'm the pharmacy manager at Culpeper Medical Center. It is truly an honor to have the opportunity to speak to you on this wonderful occasion. These are certainly unique times. You are graduating into the healthcare field in an era unlike any other, and a time when the world has experienced not only the tragedy and suffering associated with a global pandemic, but also through cutting-edge science, developing new technologies, new treatments, new vaccines, providing us the hope of a better tomorrow. This is an exciting time to begin a career in healthcare, a time no other class besides yourself can lay claim to. As you venture out into this brave new world, I'd like to share a couple of things that I've learned along the way. First, I've been practicing in healthcare for over 35 years. Yet, no matter current circumstances, some core aspects of healthcare never change. As you begin your healthcare journey, understand that unlike many other callings, healthcare is very much a team sport. This is not accounting or computer science. While accounting and computer science may need the help of others to complete their tasks, teamwork is necessary, required in healthcare in order to treat the patient. Just as no one player on a baseball team is responsible for winning, no one member of a healthcare team can cure a patient. Physicians cannot repair broken legs on their own. Nurses cannot treat patients without the help of others. Pharmacy technicians, lab phlebotomists, medical imaging technologists, none of these by themselves treat a patient. However, all of them together are necessary, are required to safely and effectively diagnose, treat, and cure a patient. Think of a bicycle tire. Bicycle tires contain a number of spokes, each spoke connected to a common center, the hub. As the wheel turns, each spoke receives support from the one before it, provides its own support, and transfers that support to the next, allowing the tire to safely and effectively move over various terrains. Healthcare is no different. Healthcare workers receive, provide, and transfer their knowledge, their expertise to and from the next discipline while treating a patient. Working in harmony, moving in the same direction, separate but equal, they continue to move forward over various health terrains, some smooth, some rocky. Although they may have different titles, degrees, and workplaces, everyone relies on each other. Everyone is working in concert because they are all connected to a common center, a common hub, the patient. While teamwork is necessary for patient treatment, an individual touch is required for patient care. Often the words treatment and care are interchanged in the healthcare conversations. However, they are different. Treatment is the action performed. Treatment is the lab test, the patient assessment, the blood draw, the CT scan, the IV insertion. Care is the provision of what's necessary in the moment. Care is the kindness and concern that you give to others. In your journey, no matter where you practice, you will often see people at their most frightened, their most vulnerable, after hearing that a loved one has passed, after receiving a poor prognosis. In that moment, the patient or family member doesn't need treatment. They need care. They need a personal and human interaction. They need a friendly smile, a comforting word, a held hand, a shared tear. They will need you as a person to provide support, to listen to them, to hear them. Providing patient care, being a caregiver, not only helps the patient to truly begin to heal, but also serves to remind each of us why we chose this profession: to help people. As you look back over this past year, as students in your chosen fields, the strength and determination that you exhibited was remarkable. When you began your educational journey in healthcare, no one could have imagined the extraordinary circumstances that you would be encountering. Without a traditional roadmap, without a playbook, utilizing new technology to learn, you rose to the occasion, conquering new challenges, moving forward into the great unknown. You not only persevered, you not only survived, but you excelled, thrived in the midst of chaos and uncertainty. You laughed, you cried, you rejoiced, you listened, you learned, and ultimately you graduated. Now, as you venture out into your respective careers, into this new landscape, you, like the many you will join, are battle-tested through experience and excited for the journey ahead. Like those spokes on a wheel, we will move together, continuing to provide treatment to those in need and care for those in our charge. Congratulations and well done.
Thank you, Mr. Smith, for your encouragement as we move forward into our chosen professions. We will now begin our pinning ceremony. You will note when your graduate's name appears across the screen that any associated award or honor will appear with their name as well. We will first recognize our Nurse Aide graduates who, upon completion of their certification exam, will be CNAs, Certified Nursing Assistants. Congratulations, graduates. We will next recognize our Medication Aid graduates. These graduates, upon completion of their certification exam, will be RMAs, Registered Medication Aides. Congratulations, graduates. We would next like to recognize our pharmacy technician graduates. Way to go, grads. Our practical nursing graduates will be next. Following graduation, these students will complete the NCLEX PN and will be registered as licensed practical nurses. Congratulations. Now let's recognize our dental hygiene graduates. These individuals have completed their Associate in Applied Science in Dental Hygiene. They have completed their National Dental Hygiene exams and their Regional Clinical exams, all required for licensure, and they are awaiting results. Best of luck, grads. We know you have this. Now let's recognize our physical therapist assistant grads who have completed their Associate in Applied Science and Physical Therapist Assistant. These graduates will sit for the MPTE exam in July to become licensed physical therapist assistants. Last, we will recognize our nursing graduates who have completed an Associate in Applied Science in Nursing. Upon graduation, these individuals will sit for the NCLEX RN to become registered nurses. Way to go, grads. Thank you for celebrating with us today. I thank all who made this celebration meaningful and memorable. Graduates, we are so proud of you and the progress that you have made. But remember, believe it or not, the study marathon is not over. Your marathon will end the day you take your licensing exam. Did you know that passing your licensing exam is a choice? It's not just something that happens because you passed your program of study. Today, you are making the choice to pass or fail that exam. Did you know that? There are two things to consider when contemplating whether to choose to pass your exam. The first of those is financial. Did you know that if you fail your licensing exam, it can cost you up to $30,000? Yes, it's not just repaying for the exam. You are losing approximately a quarter of a year's wages as a licensed professional as you wait to test. You will likely lose your first choice job, as your employer will likely hire another individual in your place who passed their exam. Last, think about the ongoing financial strain of your family. They have been waiting for you to finish and to get out there and work, haven't they? The next important thing to consider when choosing to pass is, did you know that your likelihood of passing on your first try is about 80%? Higher if you went to Germanna, almost 95%. Did you know that individuals choosing to take the licensing exam twice, that pass rate drops to 50%? Who wants to be in those odds? You see, for the last 2 years, you have been running a race, a marathon. You've been training for this marathon. But the race is not over just because you've graduated. It's over when you take the licensing exam. Please continue to exercise until the day of the test. Why would you stop training and exercising before the race? The same is true with your licensing exam. You need to exercise and train your brain until the day of the test. You might be saying, well, how do I do that? Get out your review books and let's begin. It has been shown that if you take 20 questions a day and then 50 questions once a week, this leads to passing your licensing exam. Pretty easy, huh? Just take some dedication. When taking these questions, treat them as an exam. Only win 1.5 minutes per question. After you quiz, review what you got right, review what you got wrong. Then study, crazy as it sounds, only what you don't know. Do this daily. If you break from this regime, you are choosing to fail. The choice is definitely yours. You can take that graduation cruise after the licensing exam. Choose to pass, and then you can really celebrate. Please use these strategies we have discussed consistently each day, and I do mean each day, until you sit for your licensing exam, whether it be the NPTE, the NCLEX PN, the NCLEX RN, the Nurse Aid Certification, or the Medication Aid Certification. Remember, passing your exam is a choice. Failing your exam is a choice as well. The choice is definitely yours. Families, please support your graduates as they continue to study for this licensing or certification exam. Remember, the race is not over until you take your exam. Why would you quit your training at the 23rd mile? Exercise until the day of the race, the licensing exam. And then most important, well, maybe not most important, but to me, email me the great news. Thanks for investing in yourself, your family, and your future. Thank you for joining us today. Congrats to the 2021 grads who have overcome so much to be where they are. We are so proud of you. You did it.
It is here already. You are graduating. I just want to take a moment to send you off with the very best wishes for a successful career. I also want to say thank you. Thank you for persevering. Thank you for coming in with a smile on your face. Thank you for rolling with the zillion clinical changes. Thank you for social distancing and wearing your N95 mask, even though they made you hot as Hades when you were treating your patients. Thank you for being strong, independent students who gave 110% to your role in the education process. Thank you for never ever giving up. I look forward to seeing each of you as involved as a GCC alumni and member of your professional organization. This is just the beginning of how you can offer your talents and gifts to the local and professional community. Happy graduation and hugs.
Hello. This message is for the 2021 Practical Nursing graduates. Well done. I am so proud of you and excited for your future as a nurse. It has been quite a challenging year, and you all have made it through, which is quite an accomplishment. But a word of caution, you need to keep practicing those questions in preparation for your NCLEX because you're not quite done. But think how far you've come. I have seen so much growth in each one of you. And again, I am so proud of you and congratulations.